Hi guys. So basically, my clinicals were last semester at Maple Spring. It was on November 6th through the 10th of 2023. It was at a nursing home. Basically, some of the skills that I was really confident would be I was feeding the patients, I was answering call-outs. Like if a patient had their call-outs, they would let us go in there and ask them questions. Also, I assisted patients with lifting them, like CNAs, if they needed any help. Some of the skills that I could have done better could have been head to toe assessments. We were practicing on that. I noticed that I missed a lot of steps on that. It would be nice to have like a sheet and then just go off like all from head to toe. I also kind of struggled a little bit on vital signs and then knowing like what the patient's needs are, because like when you just work with them 1 week, you don't know them that well. What I could have done differently at the DFC also for preparing would be ask more questions and be ready to help the CNAs and RNs, whatever they needed. To increase my clinical settings, I wish that I was better on asking open-ended questions, communicating with the patients better, and learning about the medications more. Basically, some of the challenges that I faced at the clinical settings was one time I had a patient that he basically had a call-out in, and I went in there to check and asked him what he needed, and basically it was kind of hard for me to communicate with him because he was a little nonverbal. So the way that I solved it is by looking at like his hands and like how he would show me what he needed. Happens to be that he wanted to use the restroom, and I grabbed one of the CNAs and the nurses, and they helped me with that. Also, what I could have done better in these skills at the DFC with the challenge, I could have improved with the head to toe assessments, obviously, and taking their vital signs, and getting to know the patients better, like asking the nurse that that just came off the shift before me, or asking their family members, or just simply going back into like their chart notes and just like seeing like what their needs are. Overall, I can improve on my confidence in the future because I can handle things better and learn how to be a nurse on the floor. Some of the personal growth and professional growth at the DFC would like being vulnerable would be good. Would be good to just stay and be confident and just smile and be ready to be there for the day. Just asking a bunch of help questions and being more helpful to the nurses. Also, the attitude and approach with the clinicals would be just be ready to help and just be confident of what you're doing, and just be ready to work and observe. Some of the guidance that I would suggest with the new learners that are going to be heading to their clinicals would be just be ready and have an open attitude. Also smile and help the patients as much as they need, and just be ready to work. Next, the last part that I'm going to talk about is like the improvement of like the college and the faculty, and maybe the teachers that go out there would be maybe if they could help us more on the floor and just like observe us more and just be there to like answer our questions or help us with the patient or just guide us more. But overall, the experience was good. So I really appreciate the teachers that came out there and helped us with our DFCs. Thank you. That's it.